of dyspnea, angina, and fluid retention ultimately. So when we talk about heart failure, it really comes in two types, and for coding, it becomes important, and for assessing how, the patients, it becomes particularly important to know whether they have systolic heart failure or diastolic heart failure. And systolic heart failure, as we all know, is an impairment of the LV pump or the muscle because of weakening for any number of various different reasons. It's defined as an EF of less than 50%, which is normal, and oftentimes less than 40%. And it's been the aim of the majority of our therapies for heart failure over the past 50 years. There's another of There's another type of heart failure called diastolic heart failure, which, as we all know, is related to not necessarily systolic function, but diastolic function and impairment of filling of the ventricles, whether that's related to hypertensive heart disease, left ventricular hypertrophy, infiltrative heart disease, atrial fibrillation, or other arrhythmias. We also have to exclude other causes, valvular heart disease in particular, as I mentioned, infiltrated or non-cardiac causes. So we all know how to classify heart failure based on symptoms, functional class 1 through 4, based on New York Board of Heart Association classification system, where class 1 is no limitation of physical activity, class 2 is comfortable at rest, but there's slight limitation of physical activity after a couple of blocks of walking or climbing a couple of flights of stairs.